Good afternoon. Thank you all for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, December 9th, 2020. So some big news today. Health Canada just approved the Pfizer vaccine, as the Prime Minister announced early this afternoon. So plans to distribute that vaccine are moving along well for our province. I'm pleased to share that the COVID-19 vaccine logistics team met this morning and that infectious disease specialist Dr. Natalie Bridger has joined them. Dr. Bridger has played an integral role in our province's COVID-19 response to date, and her voice will continue to be valuable now moving to the next stages in vaccine distribution. The dry run of getting the first doses of Pfizer's vaccine to Newfoundland and Labrador is well underway. We will be prepared for its arrival next week and for the next batch the week to follow. This is such an exciting time for all of Newfoundland and Labrador. I encourage everyone to take a moment, sit back, and think about this development. The first COVID-19 vaccine is just days away for our province. The pandemic is a long journey, one that's been tough on all of us, but we're getting there. Newfoundlanders and Labradorians are an engaged group of people, and we tend to follow the news locally, nationally, and internationally very closely. We know what's happening in our communities, and we care. But caring doesn't mean shaming. Vile comments on social media have no place in this province, especially during this tough time. Hardworking rotational workers and their families do not deserve to be targets of negativity. People traveling into this province appropriately, following public health guidelines, don't deserve it either. So please, please be kind. We are in this together, and we need people to feel safe enough to be honest and open with public health officials, to be honest with themselves and to protect themselves and others, to come forward with COVID-19 testing when required. With the calendar days winding closer and closer to our beloved holiday season, anxieties may be rising. As Alberta imposes new restrictions, for example, to curb the rising numbers of COVID-19 infections, you may be worried the same will happen here. Please, rest assured, the COVID-19 safety measures Dr. Fitzgerald and her team have put in place are designed to hopefully prevent that. These are not easy decisions. We are all making sacrifices, and it's harder, I know, on some than it is on others. No one at this table or in public health wants to have to ask you to limit your contact with family and friends. Again, these are tough and trying decisions. We simply want to protect your health and well-being, and that's our number one priority. And these measures will do that. By following them, Newfoundland and Labrador can avoid, hopefully, another lockdown and avoid further restrictions on our ability to see our family and friends. Many of us, of course, are looking forward to this season, as we should. It's been a long, tough year. But please continue, always, to wear a mask, keep your distance, wash your hands, support your community, support your local businesses, take care of yourselves and each other. I'll now ask Dr. Fitzgerald to provide an update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have one new case of COVID-19 in the province, a male between the ages of 20 and 39 in the Eastern Health Region, and is related to travel. There have been 9 new recoveries since yesterday, leaving 20 active cases in the province. The total number of cases in our province to date is 353, and in total we have tested 65,333 people. I would like to provide an update on the cases that were announced this weekend in Central Health. To date, we have been unable to identify a source of transmission. In public health, we call this a non-epidemiologically linked case, and it indicates to us that there is or was a case of COVID that we did not know about. There could be several reasons for this. The individual may have not had symptoms. The individual may have left the province before getting diagnosed, or the individual may have assumed it was a cold and didn't seek testing. If you have a symptom of COVID-19, please call 811 to arrange for a test. As a reminder, symptoms include fever, cough, headache, sore throat, painful swallowing, runny nose, diarrhea, loss of sense of smell or taste, unexplained loss of appetite, or small red or purple spots on the hands and feet. Enhanced precautions continue to be in place in the community of Harbour Breton until we are confident that the risk of transmission is reduced. We are fortunate here in Newfoundland and Labrador to be able to enjoy freedoms that many places in Canada and the world haven't had in months. More importantly, the health of our population and our healthcare resources have been protected. As I have indicated many times, the COVID-19 pandemic is a rapidly evolving situation, and our province's circumstances can change quickly. Since we developed our guidance for the holiday season in November, we have seen isolated clusters of COVID in our province, and the second wave continues to worsen nationally and globally. So now is the time to strengthen our defenses. To that end, I'm making a change to the Special Measures Order on the gatherings under the Public Health Protection and Promotion Act. The order sets out a maximum number of individuals that can be in a gathering. For informal gatherings, such as those with family and friends, the maximum was 50 people for Alert Level 2. Today, I am amending this to a maximum of 20. This will come into effect at 12:01, December 10th. Making this change provides greater clarity to those looking for guidance and adds another layer of protection against COVID-19. While 20 is the legal maximum, there is more that needs to be taken into consideration when planning a gathering. Any gathering this holiday season should be with your close, consistent contacts. Remember 20 for 2020. The number of people in any such gathering should be only as large as the space permits for physical distancing. This may be less than 20 people, but it can be no more than 20 people. Providing self-serve food options is not recommended. Sharing food and utensils may increase the risk of transmission of COVID-19. Make sure your bathroom is well stocked with liquid soap, towels, and a hands-free wastebasket. Stay home and do not invite anyone into your home if you are feeling unwell, even if your symptoms are mild. It is very welcome news that Health Canada has approved the Pfizer vaccine for use in Canada. This means that the federal government has determined the vaccine to be safe and effective. Newfoundland and Labrador will soon receive its first shipment of the COVID-19 vaccine. As this vaccine needs to be stored at very cold temperatures, the manufacturer has indicated that we must administer the initial doses at a single distribution site. This requirement will impact who can receive these initial vaccinations. We are working to determine the priority groups for this, and we will have more information on that soon. While this signals that there is a light at the end of what has been a very long and dark tunnel, we still have a long road ahead. There are still many unknowns and decisions that need to be made around the vaccination process. That means that we will continue to navigate life with COVID-19 well into 2021. We will need to vaccinate a significant proportion of our population before we can consider easing restrictions. So right now, we simply cannot anticipate when this will happen. We are also mindful that the vaccine is not yet approved for those under the age of 19. For now, we must continue to apply our layers of protection. Wash your hands regularly and wash them well, or use hand sanitizer. Wear your mask in indoor public spaces. Maintain at least 6 feet of physical distance from those who are not your close contacts, even when wearing a mask. Keep the number of contacts low and stay home if you are unwell. Remember, each of these layers on their own offer some protection, but used together, they provide a strong barrier. As a recap for those who may have just joined us, we have 1 new case since yesterday's media advisory, and the total number of cases in the province is 353. It is because of our combined efforts that our province has come this far. Let's keep up the good work and not lose our momentum over the holiday season. This virus doesn't care what you did before now. What matters is what we do going forward. Take care and hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now ask Minister Haggie to provide an update as well.
Thank you very much, Premier. Well, we're into day 277 with only 20 active cases, a significant drop compared with yesterday. So once again, congratulations to the hard work of the people of Newfoundland and Labrador. You are listening to Dr. Fitzgerald's recommendations and following them, and you can see the benefits of that. I'd also like to take a moment actually to acknowledge another truly crucial element of the public health system, and that's our contact tracers. Our record as a province in tracing contacts is stellar. I would argue it is, if not the best in the world, it is pretty well nearly there. We get 90% of contacts identified within the first 48 hours. A lot of the other jurisdictions who boast of their results can do no better than 70%. And it is down to these dedicated individuals who spend the time, ask the right questions, build a relationship with the client to get the information that we need to contain the virus. And we have been successful thus far. We have seen clusters, and we have been able, through the diligent efforts of public health and contact tracing, to identify them all rapidly, test and isolate those at risk. This policy is working, and we will continue to have to rely on this, as Dr. Fitzgerald says, until a significant proportion of our population have the vaccine actually in their system. On that note, the thermal shipper from Belgium has arrived. The dummy cargo was kept appropriately cold, and the system works. And I believe the shipper, if not on its way back to Belgium, will be going out there shortly. This now means we are poised, having received Health Canada's approval to use the vaccine, to have our first deliveries next week. As the Premier referenced, the Vaccine Committee met this morning. Our plans are significantly advanced, and by the time the vaccine arrives, we will be in a position to highlight those high-risk groups which will receive the first doses. As Dr. Fitzgerald says, the system is being built one piece at a time, so the first doses will be done around the centre at which the vaccine arrives, and given our logistics, currently that will be based in St. John's for at least the first 2 shipments. So that'll be next week, and all being well the week after. I'd like to thank the members of the Vaccine Committee for their hard work and the planning that's gone into it thus far. And we will be keeping a very close eye on the situation on a regular basis to make sure that we stay on track and that we are able to take advantage of any new advances. There are stories about Moderna being available next. We don't have a timeline for that. That is a vaccine that is easier to distribute and would certainly be ideal for more rural and isolated communities. And behind that come the AstraZeneca vaccines and the Johnson & Johnson ones, which are very much along the lines of regular flu vaccines in terms of how they would be delivered, and that will make it easier to get the vaccine into a larger number of people. But again, that will take time, and that will take us into the summer of next year. In respect of the situation in Harbour Breton, we happy to announce our first deployment of the rapid test ID Now. That is in a courier on its way to Harbour Breton. The training will be completed by close of business tomorrow, and it will be available for rapid results for the people in Harbour Breton Friday morning. Again, people who are eligible, and the criteria are going to be enlarged somewhat, should call 811. They will get an appointment. But using ID Now, it's a quicker process both to do the test and to get a result. And we will look forward to seeing how that helps clarify the situation in Harbour Breton. The other thing I want to mention is around our website. It is under reconstruction behind the scenes. We did say that we would go back to a somewhat more detailed way of presenting information, and I hope to be able to have that sorted out by tomorrow and certainly by Friday. The other thing we're going to do for clarity is to dedicate a specific page to isolation requirements. I think with the various categories of individuals, that would be helpful. So anyone traveling into the province would be able to see at a glance what their particular isolation requirements might be. Obviously, for illness or medical care or bereavement, those kind of things, there are always flexibility around that, and that would be done on an individual basis. Really, with that, Premier, I think I would conclude my comments. I think it's important to see the light at the end of the tunnel, to realize it will be a bit slower than everybody wants, and yet again to recognise the hard work that everybody in this province has done in following Dr. Fitzgerald's guidelines. So thank you very much, Premier.
Thank you, Minister. I'll certainly now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, I think a lot of people are going to be concerned with the fact that the case in Harbour Breton is now not being able to be traced to somewhere. We've had a lot of success over months and months of always having cases linked to somewhere else. How concerning is this for you that there may in fact be other cases that we're missing right now?
Yes, that's always a concern when we have a non-epi-linked case. I will say that public health is still working very hard to try to find a possible source. So the investigation is ongoing, and we are testing people. We've expanded that testing criteria and asking for more people in the community to come forward and get tested. We do want to find that, and we're tracking down every lead that comes our way. But, you know, sometimes we don't. We do end up with a situation where we can't find the source of the case. And that has happened here on a few occasions in the past. And, you know, we're going to keep working on it. But if we don't, we'll just have to deal with what happens. But, you know, it's always concerning, because I think this demonstrates to us, should demonstrate to all of us, that no matter where you are, there is always that chance that COVID can be around you.
So how concerned should people be then that we end up seeing spread because of this, where it's not just one case, it becomes 3, 4, 5, 10, 20?
So that is always a concern with non-epi-linked cases, is that, you know, the person that presents as positive may be a 2nd or 3rd generation transmission from the original source. But we always, you know, that's why it's so important for us to adhere to those public health measures that we've talked about to reduce that risk of spread. When we're attending gatherings, when we're in close contact with people, not wearing masks, you know, going out when you're sick, then you're much more likely to increase the risk of spread if you do have COVID, or if you're around someone that has COVID. So we all need to be vigilant, and that's what this tells us, is that we all need to be vigilant. And, you know, we may end up finding cases related to this, and if we do, we'll deal with them. But we certainly, I think, Central Health and people in Harbour Breton have acted very quickly to sort of change the way things were being done, and you know, in reducing their contacts and being more careful. So hopefully we can prevent further onward spread.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Dr. Haggie, you mentioned that rapid test kits are being deployed to Harbour Breton. How many of those rapid test kits are being sent out?
My understanding is that there will be somewhere of the order of 1,000. We do have a regular supply coming in or accessible through the federal government. This is the ID Now kit, which is a speeded up version of the PCR test that is currently only done in the public health lab. We are not worried about our supply of the kits to use in the machine.
And moving on to the vaccinations, Ontario is saying that they're going to have a proof of vaccination card. Are we considering doing anything like that here?
Well, that's certainly something that the vaccine team is considering and evaluating now, and provide an update once the team makes their decisions.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Yes, hi. I'd like to ask about vaccines as well. What do you make of the warnings about allergic reactions after the initial vaccine injections in the UK?
Yes, so Peter, thanks. I've just become aware of that this morning, so those warnings that came out. So I think we certainly have to wait and see what the evidence shows from that. It's really very early. We don't know the nature of these vaccines. That will be something I'm sure that the National Advisory Committee on Immunizations will be looking at closely, and will evaluate those concerns. But Health Canada has approved this vaccine today and considers it to be safe and effective to use.
Okay, thank you. And with regard to people who are, sorry. Oh, sorry, I thought someone else was trying to talk. With people who are vaccinated, you're talking about people taking liberties once they're vaccinated. I'm wondering, for example, if someone decides that they're invincible enough now to travel once they get the vaccine, what would you say to someone like that?
So certainly, our recommendations at this point will be, even if you are vaccinated, we still need to pay attention to those public health measures that we have in place. The long-term efficacy of a vaccine is not known at this time, just because we simply don't have, we don't have that luxury of time to test it. So, at this point, I think it's very important to remember to follow public health measures until a significant proportion of the population is vaccinated.
Right. Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Premier, to Richard Duggan's question there, you had said that the vaccine committee is looking at and evaluating, considering a sense of like a vaccine passport, something like Ontario has said that they will be doing as an issue proof of COVID vaccine. In considering that puts up a lot of alarms for people here, as you said that the vaccine wouldn't be mandatory. Can you elaborate on how seriously they're considering this?
Well, there's certainly a distinction between being mandatory and given proof of vaccine. I mean, currently we still provide individuals with proof of vaccine. So this is something that is certainly being considered. Of course, there's all the different, privacy issues, ethical issues that need to be weighed and balanced and measured. I never said that this would happen. I said this was going to be something that would be considered by the team.
Yes, and I understand you said it's something that's being considered, but the one that is being used in Ontario or under consideration there as well would be tied to more freedoms, essentially. Like if I had the vaccine, I could then
I saw that.
I could travel easier.
Yeah, no, I saw that. I think Premier Ford and his task force are looking at, using it as a passport, if you will, to more social freedoms. And frankly, the epidemiology is different in Ontario. The population is different in Ontario. I trust the task force, the team, the vaccine distribution team that we have here, and the advice of Dr. Fitzgerald and Minister Haggie that they will land on a decision that's appropriate and safe and responsible for Newfoundlanders and Labradorians.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. I'm wondering, is this government considering hiring a third-party firm to help with the vaccine rollout?
That hasn't been something that we've considered so far. We've certainly taken up the federal government's offer to have military involvement, and as we roll out this vaccine and see where the potential weak spots are or how the plan is stressed, it's certainly we look forward to working with the military in concert with the vaccine team here as we continue to roll it out. We haven't given any further thought at this particular moment in time to outsourcing anything further than that.
Right, and to follow up on that, I'm also curious if you're going to bring in an observer of some kind for this work.
I'm sorry, could you repeat the question?
Oh, sorry, I'm curious if you'll bring on an observer for this work.
An observer?
Yes.
Well, all of this work will be monitored appropriately. Of course, there's great oversight on all of this, whether it's our local officials or nationally, to ensure that this is being rolled out in an effective, responsible way and tracking side effects if they occur, when they occur, who they occur in it. So all of that will be monitored. There's been talks at the First Minister's level about a shared database. And Dr. Fitzgerald, and I know that these conversations are happening at multiple tables, the health ministers' tables, the CMHO tables across the country, and this is all something that this will be monitored, if that's the question that you're asking.
Yeah, thank you. Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. My question is regarding the first people who get their vaccine next week. Do any of the rules change for these people once they've gotten their first vaccination?
Nope. Number one, the vaccine needs 2 doses to be considered effective. And right now, the recommendations are that all public health measures still apply.
And then once the person or the people get their second vaccine, can you give a little bit of an idea of whether rules were changed for them at that point?
No, our rules will stay the same. As I said earlier, our public health measures have to stay in place until we get a significant proportion of the population vaccinated. So that'll have to be upwards of 80–85% in order for us to have what we would call herd immunity, or what's commonly known as herd immunity. So this vaccine will help protect the vulnerable. That's the most important, and that's the goal of our vaccination right now. In these first doses of vaccine that we're getting in the first quarter of next year is really about protecting those vulnerable people. So making sure that we've got a cocoon around them, so to speak, and to protect those people who may be at higher risk for coming into contact with people with COVID. And then after that, we look at broader vaccination. So our goals are in the first quarter is not to give enough immunity that we're going to be able to change those public health measures for now.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Premier, you had a meeting with the Prime Minister today, one-on-one, outside of the broader all-Premier meeting. Just wondering what came out of that. What were the discussion topics and what was decided?
Nothing just yet. The meeting is scheduled for later this afternoon, but we'll be discussing a broad variety of topics, including COVID, the impact that COVID has had on our province, how we're doing with respect to vaccines, and I'm sure there'll be other issues that arise.
Thanks. Dr. Fitzgerald, I have a follow-up question for yesterday's case that we saw that was tied to travel from the Northwest Territories. They don't have any active cases right now. It's been almost a month since they saw their last new case. So in that instance, have we actually tied or figured out the source of transmission? Was it in fact from the Northwest Territories, or where did they pick up COVID?
Yeah, so, somebody who's traveled in may have picked up COVID anywhere along that travel process, right? So it's difficult really outside of the province to be able to determine just where that may have happened. But what we do know is that, it appears that this person has been isolating, and so the risk to everyone is quite low.
Thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. In regards to the new case that was announced today, did this latest case get an exemption, travel exemption to enter the province?
I'm unaware of the details at this point. I apologize. We may be able to get that information for you.
Okay, thank you. And I have a question about the cases we've heard of in the Western Bay area. Cell service isn't very good in some of that area, and we've heard concerns from people in that area that about the COVID alert app, and they're concerned that because of the spotty cell service that they won't be notified if they come into contact with a potential case. How do you respond to those concerns?
The COVID alert app relies on Bluetooth. That works on a proximity basis. The data is then uploaded and dumped into the system only in the sense that if there is a key issued to one of those phones, that will then rely on the cellular system to transmit it to the other phones that have a Bluetooth key. So the data is stored, it just isn't accessible immediately. But presumably the people in Western Bay will also have access to Wi-Fi, and also some of their family members will be traveling for groceries and those kind of things in the ordinary course of events. I'm not familiar entirely with the geography, but I am aware that my colleagues in other departments are working with local businesses, local providers, and the federal government to improve cellular service in that area.
Thank you.
Our next questions are from Peter Jackson with the Telegram. Please go ahead.
Thank you. You mentioned Alberta locking down. Would you say it's fair to say that provinces like Alberta and Ontario are basically shutting the door after the horse left the barn?
I know. I think they're doing what they feel is appropriate to do at this particular moment in time, given the epidemiology in their own province. We're interested, of course, in protecting our province, and so we're making our decisions for the people here in Newfoundland and Labrador.
Do you think Alberta could learn anything from Newfoundland and Labrador?
I think it's worth reminding people that Newfoundland and Labrador, thanks to Dr. Fitzgerald and her team's advice, have been out in front on a lot of issues. We have been early adopters, if you will, of many of the tools in the toolbox to help spread the COVID-19 virus. So in things like face masks, they're only adopting them in other jurisdictions now. We've been, it was mid-August when we did that. We've taken a lead role in implementing some other things. We're restricting size of gatherings and ahead of others as well. So, I think, others, as Dr. Haggie said in the intro, other jurisdictions can learn from us in this example, but now's not the time to force others to kind of adapt what we're doing. Now's the time to continue to help protect Newfoundlanders and Labradorians, and where we can be an example, where others can change their behavior, then we're happy to lead by example.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. In regards to the priority of who will receive some of the first doses of the COVID vaccine, knowing that it has to remain on the site that it's delivered to, so the health sciences, and Dr. Tam's comments yesterday regarding long-term care residents, I guess they're not as likely to be receiving those first doses as they would have to be transported to the health sciences and then out twice because of the double dose of the vaccine.
Yeah, so there are some limitations, and so we are developing a plan for how that will roll out, and we will have some information forthcoming on that in the coming days.
Thanks. And I have some questions regarding the changes to the special measures order regarding the informal gathering sizes, changing from 50 to 20. How does this apply to businesses, restaurants, bars, those organizations?
So it doesn't, in the sense that these refer to informal gatherings. So they will be gatherings that are not organized by a business, and the special measures orders does differentiate between those two types of gatherings. So if you're having a gathering that's been organized, where a business can put things into place to make sure that there's a reduced risk of COVID spread, that tables are separated, that there won't be mixing of bubbles, so to speak, then I think, that's a different situation than an informal gathering where those things may not be as likely to happen. Certainly what we know is that there can be spread in some of these organized gatherings, for sure. We've seen it everywhere, but there's a lot of we're seeing a lot of spread in areas in these informal friend and family gatherings that, and parties and that sort of thing that are happening, and in indoors, close quarters. So we're really trying to limit that risk as much as possible with this change.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Can you give a few more details about the vaccine committee, like who's on it and how often they meet?
Certainly. I am, for better or worse, the chair. Dr. Fitzgerald sits on it. We have staff from the regional services because it's the RHAs that will actually operationalise the delivery. We have representative from civil service in Cabinet Secretariat. The most senior civil servant in government sits on it. We have Dr. Bridger, as has been referenced earlier on. We have Minister Dempster representing Indigenous and Labrador affairs. And we have Minister Bennett representing municipalities. We also have a representative of the Royal Canadian Navy, Commander Botting, who has extensive logistical experiences, and he is our link with CAF and Chain of Command through a Joint Task Force Atlantic.
Thank you. And 353 people have had the virus in the province, and we know that long after people have recovered, they can have some long-term serious ailments. So I'm wondering if you can give us an idea of what these people might still be living with.
So to date, I haven't received information to indicate that there have been significant issues in that regard. We're certainly aware that it can, there are people who have reported long-term issues. I think as time goes on, we will learn more about this, and there will be a lot of discussion, a lot of research that will happen once we get through this pandemic about such things. But we do know that some people can have long-term effects from many viruses, COVID included, but influenza and other respiratory viruses can have these type of long-term effects.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. I'd like to ask for your reaction, Premier, to the further airport closures and canceled routes in Atlantic Canada. Do you fear further cuts or closures to regional airports due to the travel restrictions that have been in place?
Due to the current travel restrictions?
Yeah.
These are complex. It's a complex industry in the best of times, air travel, and it's been one of the hardest industries hit by this global pandemic. Unfortunately, you feel the ripple effect of those global external forces at play here locally. I'm hopeful that these routes will be returned once air travel is not only safe but has the return of customer confidence.
And can you give us a bit of a primer on the meeting that's to be held between the First Ministers and the Prime Minister tomorrow?
Well, primarily the purpose is surrounding the Canada Health Transfer, of course, and it's up for renewal. And the Canadian premiers had put forward a proposal to the Prime Minister, and this is our first opportunity to talk as First Ministers. Normally, of course, this meeting would be held in person, but we're doing it virtually. Of course, with the exciting news this week, I think there will be a portion of this meeting occupied in discussion on the vaccine and provincial rollout plans, and even some lessons learned, perhaps, so that we can adapt accordingly.
I will now go back through each reporter to see if you have any final questions. Peter Cowan with CBC. Do you have any final questions?
I do. Dr. Fitzgerald, in reducing the gathering sizes, why not change to the next alert level, considering it already had gatherings of 20 people that were part of that?
Well, we're not changing everything else in the alert level. We're just changing the gathering size. So as I said before, we're now trying to be more focused, more refined, and we're looking at trying to reduce the risk where we feel the risks are. So going back to alert level 3 would have been what we feel unnecessary at this time, when we know that gathering sizes and gatherings in general are the thing we're really worried about.
Christmas usually means a time when a lot of people end up going to church, and right now those are the formalized gatherings that are still at 100. Do you expect to reduce those numbers between now and Christmas?
So everything depends on the epidemiology that happens. If we start to see a lot of community spread somewhere, then we may have to do that. Certainly, if things stay the way they are at the moment, we don't anticipate that will be the case.
Okay, thank you very much.
Richard Duggan from VOCM. Do you have any final questions?
Yes, I've seen and heard a lot of comments from people who say that they won't be getting the vaccine once it's available to them, at least not right away, for fear of side effects. And they argue that the vaccine hasn't been around long enough to truly know what those side effects are. You're pushing for people to get the vaccine, so how do you respond to those fears from people?
I think we can all respond to that if you want to take it first. But, I mean, you have to trust Health Canada first and foremost. I mean, this has been put through a rigorous process. These are the same credentialing people that have proven that other vaccines are safe. And make no mistake, vaccinations are one of the modern marvels of medicine, and it's changed life expectancy, reduced morbidities, all with very minimal side effects in overall. So people need to have confidence in the bureaucracy and the rigor of the scientific process to enable them even to get to Health Canada in the first place. And this is a historic day, and I think people need to see it as a positive moving forward. It's our job on this table and beyond to ensure people and educate people as surrounding the positive benefits of this vaccine. I don't know if you have something to add, Dr. Fitzgerald.
Yes, so, I mean, certainly you're right, this vaccine hasn't been around a long time, but neither has COVID. So, you know, we have to think about how we want to move forward, and really the best way to get us out of this is a safe and effective vaccine. And the Premier's right. Health Canada has a very rigorous process for ensuring the safety of these vaccines, and I think if there were any concerns, then certainly approval would not have happened. There has been concern expressed, certainly to me, about the speed at which this vaccine was developed. But as I've said before, the reason that has happened is not because steps have been skipped in the whole process. It's not that at all. Is that there's been an overlapping of the process, and so vaccine manufacturers would normally, do their research and development. That could take several years, and they would do that before they would even think about testing. And then they would have their manufacturing process after that. Once they got approval, then they would manufacture it in large enough doses to give to the public. What's happened now, because there was a recognition on the world stage that this needed to happen quickly, funding was assured, so these companies were able to overlap a lot of that process. So the manufacturing process, the things that had to be put in place were already there by the time the research, development, and testing was done. So we've shortened the process by overlapping, but all the steps that had to happen are still there. And so I think we can certainly rely on the fact that Health Canada has applied the same rigor to this vaccine that they would to any vaccine that's coming up through the pipeline.
Our next questions are from Peter Jackson with the Telegram. Do you have any final questions, Peter?
I just have one, and I realize, Dr. Fitzgerald, that you've been very granular about self-isolation. I'm thinking of someone who is...
Sorry, Peter, you're quite muffled, Peter.
Sorry. I'm thinking about someone who... Can you still hear me?
Yes,
Yes,
we can hear you.
Yeah.
Sorry. Someone who's self-isolating on Christmas Day. They are physically distancing. They're not sharing utensils. They don't go with self-serve food. Can they be in the same room, say, under those guidelines as the rest of their family?
So what we have recommended is that anyone who is isolating in the same house as other people should avoid common areas of the house. Certainly, that expectation would be there for Christmas. It would be it's unfortunate, but that is the expectation.
Okay, thank you.
Kellyanne Roberts with NTV. Do you have any final questions?
Yes, I have two. One being around the vaccine. Will security increase at the Health Sciences Center, knowing that this will be the site to hold the first doses?
there will be increased security around the location of the vaccine and the depots.
Thank you. And I have another question regarding a sports banquet that's to happen in Corner Brook early in the new year. There's involvement from a lot of people all over the province. The plan is to keep the attendance under government regulations with social distancing protocols, but I guess there's still concerns if whether or not this should go ahead. Dr. Fitzgerald, Minister Haggie, Premier Furey, your input?
So I haven't received any information about such an event, and if there were concerns about it and they brought it forward to the team, I think the team would have reviewed that and provided feedback. So I really don't know that I can comment on an individual event in this venue.
Thank you.
Elizabeth Witten with All Newfoundland and Labrador. Do you have any final questions?
No, I don't.
Thank you. Patrick Butler with Radio Canada. Do you have any final questions?
Yeah, just one. Why? Maybe I feel like this is going unsaid, but just don't want to make it really clear. Why is it important for a person who has received both doses of vaccine to continue wearing a mask and following different rules like gatherings and things like that?
So, because we are, we're still in a situation where we want to make sure we reduce the risk of COVID as much as possible. Every individual is different. We don't know how each individual is going to respond to a vaccine. We may not know that for some time down the road. So, and I'm sure there will be studies that will be looking at that as time goes on. But, even with the 90% effective rate, we're still looking at a certain portion of the population who may not respond, and we don't know immediately who those are. So we are keeping those measures in place, and there will still be a significant portion of unvaccinated people. So the risk of spread through, in the province, if COVID were to get into the community setting, would still be, almost as high at the end of Q1 as it would be right now, and just because of the number of people that we would be able to vaccinate by that time. So, we have to be, this is a very, very exciting thing that we're getting vaccine. I am ecstatic. I was, there were tears in my eyes earlier today. There's no doubt that this is very exciting, but we need to be realistic, and we need to understand that, this journey is not over yet, and we've got a few more months where we have to hang tough.
Thank you.
Thank you, everyone. Premier, do you have any final comments today?
Well, thanks again for joining. We know that everyone at home are beginning to make more formalized plans for their holiday season, and none of us are taking the decisions that have been made towards this holiday season lightly. They weigh heavily on all of us. But just like COVID-19 knows no limits in terms of geography, it knows no limits in terms of what day of the week or what holiday season it happens to be. So please respect the rules, follow them, wear a mask, wash your hands, and keep your distance. And even though we're in a historically positive series of days upcoming, the finish line is in sight, but we haven't crossed it yet, and we still have a ways to go, but we can get there together.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.